Today we are going to be talking about diathermy and how we use that in a PT setting. All right, so here is our outline you can take a look at. And some of the physical properties of diathermy. So diathermy means through heating, and it uses electromagnetic energy to heat up tissues. Some of the parameters. The frequency, there is a shortwave diathermy, which is usually using 1.8 to 30 megahertz. And the FCC, which stands for, U.S. Federal Communications Commission, the U.S. Federal Communications Commission, realized that diathermy, so it uses same radio frequency waves that are used for communication. And they realized that the machines were interfering with communication. And so what they did was they determined certain frequencies that are set apart for medical use only. And so diathermy can only be used on those frequencies, and that way it doesn't interfere with communication, and communication doesn't interfere with the diathermy. So there are certain frequencies that are reserved for medical use and preset in the diathermy machines to use so that it doesn't interfere with any communication. So the wavelengths that were preset for shortwave are 13.56, 27.12, and 40.68 megahertz. You don't have to memorize those or anything. That's just kind of for your information. And then with the microwave, they chose the 2450 megahertz as the wavelength that's used. So most diathermy machines come preset with, all of them are going to be preset with the specific waves you can use that are already approved, but also typically the parameters are preset in there, and the only thing you can really change is like the intensity and the duration. There's a few machines that may have additional options, but typically the frequency is already set for you. It can, just like with ultrasound, be pulsed or continuous, and the continuous again has the heating effect, and the pulsed has the non-thermal benefits without the thermal effect. One other thing that I'll say before I move on is the microwave diathermy machines are not made in the US, but you can order them from other countries, whereas the shortwave are. So they're a lot more available within the US than the microwave ones. All right, the thermal effects. So it increases the temperature in the treated areas. The amount of temperature increase depends on the intensity, the tissue type, the duty cycle, and the distance that the diathermy machine is from the patient's tissue that you are heating. The tissue temperature will increase if the average power of the diathermy machine is greater than 38 watts. It's able to heat more deeply than hot packs and larger surface areas than ultrasound. So that's one reason you may choose diathermy over the other two, depending on the treatment area and your goals. With shortwave diathermy, it's not reflected by the bone, so it doesn't have that risk of the burning like an ultrasound does. And so you can use it directly over bony surfaces without that risk. There are 3 different types of applicators for diathermy. So one is this inductive coils. The ones on their left are great for picturing what's going on, but they're not really used in that form anymore because it was just really cumbersome for the therapist to wrap the coils around the treatment area. So the pictures on the right are the types of inductive coils that are used now. And they use a coil within the treatment head there that just goes over the treatment area versus wrapping around the whole limb. So they use eddy currents. Remember, eddy means causing waves, causing circular movements of materials, and so it causes that oscillating circular movements of tissue particles, and it causes friction, which creates heat. So kind of like with a whirlpool or something like that, causing that inductive heating pattern. Capacitive capacitive plates, also with shortwave diathermy. The current flows from one plate to the other with the patient's tissue in between, and so the patient's tissue becomes part of the current. So there is a head on either side of the tissue. You need to have them equal distances. So like if the one in the front is an inch away from the patient's shoulder in the picture, then the one in the back also needs to be an inch away. So they need to be equal amount distances away from the patient's tissue before you can use it effectively. Another thing, I already mentioned it, but the patient becomes part of the electrical current. This is just showing a comparison of heat distribution on different types of applications. But if you notice, it goes fat, muscle, bone, muscle, fat. And so the reason the capacitive plates is the only one that has it on both sides is because it's the only one that passes the bone and goes through to the other side, because it has the applicators on both sides of the tissue versus all the others are on one side, and so they stop at the bone versus going through to the other side. So that's just kind of for your reference. You don't have to memorize that or anything. The magnetron is the one that does a micro, so all the others were shortwave diathermy, and this one is the microwave diathermy. I mean, although I knew that, it just feels wrong to say microwave because we're used to microwave, which uses the same type of magnetron that this machine uses. So it uses an antenna to produce high frequency alternating currents that produce heat. So again, it's the same, a magnetron is the same type of thing that's used in a microwave oven, and it's the same that's used with this microwave diathermy machine. These are not produced in the US, and so it's very, they're not real common to see in clinics. But it can produce standing waves that heat unevenly, so that's not a great thing. And it does not penetrate as deep as the shortwave diathermy. So those are kind of two negatives to this type of machine. And although in this picture over here, it shows it like way far away from the leg, we'll learn in a later slide that it needs to be within an inch or two of the leg. So that would be way far away. Some of the effects, the thermal effects. So it's used to heat large, deep areas of tissue. It increases your circulation. It increases your tissue extensibility. With the non-thermal effects, it actually increases the microvascular perfusion. So it increases the oxygen and the nutrients and the phagocytosis that occurs in an area. So something that, like a demonstration or example that would make sense to me, hopefully it makes sense to you, is so if you have a lot of boxes piling up in a warehouse and you want to get them out quicker, when you increase circulation to an area, it would be like sending out more trucks or more vans that deliver the packages. If you're increasing the microvascular perfusion, then you're increasing the rate that each driver is able to deliver the packages. So the more packages that actually get out from each truck versus increased circulation is like more trucks driving around. Okay, so increased circulation, there's more movement of the fluid, but increased microvascular perfusion is the nutrients, the oxygen, and things that actually get delivered to the tissues are more available and being delivered more rapidly and available for tissue healing. So this increases your tissue healing is the main benefit there. It alters the cell membrane function and the cellular activity, which helps with pain, with edema, with inflammation, and ultimately with tissue healing. So that is those main benefits of diathermy. Clinical application. So you'll use thermal diathermy if your goal is for pain control, to increase tissue healing, for joint stiffness, or to increase range of motion. You can use the non-thermal also for pain control and also for tissue healing, but also for the tissues like nerve and soft tissue and bone. healing, especially if inflammation is a factor, if it's an acute injury. And then it can also improve osteoarthritis symptoms. Contraindications. All diathermies cannot be used over an implanted stimulator, such as a pacemaker or a deep brain stimulator. And they are contraindicated for anybody that is pregnant. For thermal diathermy, it's contraindicated to use over metal. Remember, metal heats up too fast. That's a bad idea. Over cancers, because it could potentially increase the spread of cancer, over the eyes, the testicles, or any type of open growth plate. Just like we mentioned with ultrasound. So with ultrasound, it's more of a precaution versus with diathermy, it is a true contraindication. With non-thermal diathermy, you do not want to use it over internal organs. You don't want to substitute it for conventional other types of therapy for pain or swelling. So it can't be the only thing you're using, and you don't want to have it over pacemakers, electronic devices, or metal implants. Now, I did see in the book where it talked about using diathermy over certain tumors to decrease their growth, malignant tumors, it mentioned. And so, I would assume from this slide that they use non-thermal. However, my indication I got from reading the book was that they were using the thermal effect to overheat it and cause some of the cells to die, is what I understood from the book. So that's an interesting thing. Malignancy may just very well be only use diathermy if there is malignancy, if that is what they're specifically using for. So that would probably be more so a medical thing versus a physical therapy thing. So in that case, in case you were a little bit confused by the book, I don't want you to be confused. I would say in physical therapy, let's say malignancy is a no-go, cancer is a no-go, versus a medical doctor may be using it over a cancerous area for a certain benefit, and it would have to be a certain frequency and all the things. So I wouldn't use it in the PT clinic, but you may see it used in some instances. I just want to see if there's anything else I need to say there. Look like a no. Precautions for all types of diathermy. You don't want to use near electronic or magnetic equipment. It could interfere. For obesity. And it did say that it's most likely to cause burns in fat. So whereas like ultrasound, you want to be cautious over bone because it could overheat over the bone area. With diathermy, it could overheat in more fatty areas. So that's why obesity would be a thing. And then an IUD, the intrautero device, like the type of birth control that's implanted into the uterus. If it has copper, you wouldn't want to use it over but you also don't want to use it in general over reproductive organs. So I wouldn't use it over that area anyway. And then with the non-thermal, the skeletal immaturity is the same thing as those open growth plates, that you just want to be careful over the open growth plates so that you don't stunt somebody's growth. For the therapist, there's actually precautions. So this is a new thing. We didn't have this with heat or ice or ultrasound. But for diathermy, if you're using diathermy with a patient, it does have some radiation and irradiation that could go to bystanders. Okay, so you would want to use it like in a closed treatment space. You wouldn't want to use it in an open treatment environment with other patients walking around. And it's recommended that the therapist stay 6 feet away if the continuous diathermy is being used. And if the pulsed diathermy, which is called non-thermal shortwave diathermy, and it's abbreviated SWT, if that's being used, then you need to at least stay 4.5 feet away. But if you're pregnant, you don't use diathermy even on a patient. Okay, so if you're wanting to use diathermy and you're pregnant, just have another therapist set them up on it and you stay away. Stay far, far away. The only adverse effect is a burn, and it's specifically over fat layers or wet skin. So you want to be careful that the skin that you place it over is dry and that it's not over some very fatty tissue. Application, so very similar to what we've learned before with a few extra steps. So you first evaluate and determine if the patient is safe for diathermy. Then you select which type of device and you prepare the patient. Now, we didn't actually mention this in ultrasound, but you want to prepare them for any treatment. Always explain what you're doing. Always, in any of these modalities, remove metal or any clothing over that treatment area. You want to clean, dry, inspect the skin. If you're using a thermal diathermy, then you want to wrap the skin so that if it sweats, it will absorb the sweat and the skin doesn't become wet and more likely to burn as the treatment continues. If it's a non-thermal diathermy, the non-thermal shortwave diathermy treatment, SWT, then you don't have to wrap the skin. And then you want to position the patient and the device. In the next slide, I'll tell you how close the device needs to be to the patient, depending on the type of applicator. And then you turn the machine on. You may have to tune it if it's not self-tuning. Select the parameters. Most of the parameters are actually selected for you. So in the thermal diathermy, most of the time, the frequency, everything is already preset, and all you do is increase the intensity, and you tell the patient, tell me when you feel mildly warm sensation. And then you turn up the intensity until they feel that it's mildly warm, and then you leave it there, but you continue to check on them so it's not getting too hot. Versus with non-thermal, typically they're all set. So with thermal, we typically use a duration of around 20 minutes for that type of diathermy. And with non-thermal, it's suggested that we use between 30 and 60 minutes, at least once, if not twice a day. And so that is something that is not typical in a PT clinic. You typically, especially an outpatient, aren't going to see a patient even once every day, but especially not twice in a day. Maybe in some like rehab settings, you'd be able to do 1 or 2 treatments a day. But I don't personally know of them sending patients home with machines or anything. So it would be hard to get the amount of treatment recommended for a patient with that non-thermal diathermy, especially to be in a clinic for an hour at a time, just sitting under a machine. Is going to be pretty uncommon in most treatment facilities. Once you start the treatment, you want to come back and check every 5 minutes to make sure they're doing okay, to ask how it feels and see if you need to adjust the intensity. If it's too warm, of course, turn the intensity down. There may be some other parameters that you can adjust on a machine that you could turn down if it is uncomfortable, but a lot of them are preset. And then assess the treatment effect and document the different types of applicators. So the inductive that we talked about with the coils, you need to place the drum or the plate directly over and close to the skin or tissue being treated. So it's almost touching the skin. The capacitive applicator is the one with an applicator on either side. And it needs to be 1 to 3 inches from the patient's tissue on both sides and equal on each side, like I mentioned earlier, an equal distance from the tissue on each side. So if it's an inch on the front side, make sure it's only an inch on the back. With the magnetron, it needs to be within a few inches of the treatment area and then directed towards the skin. All of them need to be directed towards the skin. You want to document the area being treated, the frequency range, the average power, the pulse rate, the treatment duration, what type of applicator you use, the patient's position, and the distance the applicator was from the patient's tissue, and then their response to intervention. So everything you did, you document so that we can reproduce that in a safe way. So if you have any questions, just let me know.